Yes.
Hi, Miss Jones. I'm so sorry to keep you waiting so long. One of my patients over at the hospital had a problem that I had to deal with kind of urgently, so I'm so sorry to keep you waiting. And I did look over just briefly the notes that my colleague had written down, and I appreciate her checking on you while you were waiting all this time. But I always like to reconfirm things, personally. So tell me how you been.
Well, I just don't feel good.
Yeah?
No.
Tell me more.
Well, I I guess I just done put on some weight and I don't feel good.
Yeah?
I'm just tired.
Just tired?
Mhm.
Anything else?
Well, I'm not happy about gaining this weight.
Yeah. Okay. Um, well, with that, obviously, I know that you're going to be doing your best to work on the weight gain, but do you have any thoughts as to what might have caused you to gain weight? I did see you gained a little bit since the last time I saw you.
Well, I can't get out and exercise. I live in a high crime neighborhood and I don't get to exercise, and I got the grandkids there.
Yeah. Do you, so you're very busy, I guess, with the grandkids. And do you get out at all?
Well, I get out maybe once a week when my son is off work.
Okay. And what do you do then?
We'll walk.
Go for a walk? And how far of a walk do you do usually?
We walk around the park,
Uh-huh.
but my knees and everything is bothering me, when I walk,
Okay.
and I get kind of short of breath.
Okay. Tell me more about that.
Well, it's just, I just little short of breath.
Okay. Shoulder breath and your knees hurt you. Okay. Um, is this something that's relatively new, or is that something that's been going on for a while?
Since I put on the weight.
Since you put on the weight. Okay. Well, do you think you've been eating more than you used to?
Well, I've had my eat with my grandkids.
You eat with your grandkids, so that means when they eat, you eat, and does that mean you tend to eat a little more than you used to?
Yeah, snacks, and I eat when I'm just sitting around or watching TV. So
Okay. Well, I'm really glad to hear that you're interested in this because with medical conditions that get worse with eating too much, like for example high blood pressure, and sometimes developing diabetes and such. I'm really glad to hear that you're interested in doing something about this, and I see that you've actually you know got an appointment with dietitian coming up. So I think that's an excellent idea. But I'm sorry I'm a little behind schedule and everything, but I wanted to make sure that we don't have anything else medical going on too. Um, a couple quick questions. You said that you were kind of getting short of breath. Um, have have you have you also had any tightness or burning or squeezing or basically any kind of discomfort up here in your chest or your left arm or your back or anything when you go out for a walk?
no, I have a little heartburn.
Little
Like
heartburn.
sometime after a meal and when I drink a lot of coffee.
Okay, all right. That sometimes is what caffeine can cause heartburn. So it really doesn't sound like there's anything with your heart there. Another question I have is, do you know whether or not you snore?
Well, my grandkids laugh at me. They say that I make a loud noise when I'm fall asleep watching TV.
Oh, really? Okay. How often do you fall asleep when you're watching TV in the daytime?
Well, at daytime I'm there by myself, so I can't really tell you that. But at night, we watching TV and stuff. They say, since I've been so tired.
Mm. You've been
know.
more tired than usual too?
Yeah.
Okay. I think just looking at your records here and your lab work, we checked your thyroid back in January. It was normal then. Um, how about I know when I saw you last time from looking at your records here that you had a little bit of a depression back in January, and we had started you on the Celexa, the citalopram, and has that been an issue too, or is that doing okay?
It's better um, since the meds, but you know, I don't want to do anything to myself, but I just feel that life's kind of hard sometimes.
It does sound like it's kind of hard. I know it's stressful to take care of young children and all the things that they have to do, and it sounds like you don't have control over some things in your circumstances. Are you sleeping okay?
Yeah, but I wake up sometime and I just, be worried.
Be worried a little bit, but not feeling like life is hopeless like it was back in January.
No.
No, okay. Not having any thoughts of wanting to harm yourself,
No.
just not live anymore. Nothing
No.
like that.
No.
Okay, good. And your concentration's okay during the day, like if you're trying to help the kids with their schoolwork or try to get a bill paid, your mind's not wandering too much.
Well, it's okay, but yeah, I wonder sometimes.
Well, let me take a look at you if you don't mind getting up on the exam table for a second. I just want to make sure that everything looks good. Well, on your exam, everything looks fine. Your heart sounds normal. Your lungs are perfectly clear. Um, I have a couple of concerns, and I've kind of jotted them down here. And one is that obviously you have gained some weight, and you've been tired more than before. So I think it's probably a good idea for us to repeat that TSH, that thyroid test that we had done back in January, but it was normal then, and just want to make sure it's still normal, okay? Another thing is that with your having dozed off during the day and your grandkids saying that you've been snoring a lot, I wonder about something called sleep apnea. Have you ever heard of that before?
Yeah, my brother got that.
He's got that? Okay. Sleep apnea basically is when you're sleeping and you're not getting the proper amount of oxygen to your brain. And the reason that happens, just sort of briefly, is that when you sleep, all your main muscles relax, and one of those muscles is your tongue. Your tongue is attached here to the front of your jaw, and while you're sleeping, it relaxes. So that means your tongue can slide back in your throat. And a minute ago, while I was looking in your throat, it looked like you have a fairly good sized tongue, like most people do, and it could be that your tongue is blocking your breathing when you're sleeping, and then that makes it sound like you're snoring, but you could actually not be getting enough oxygen to your brain. And then what happens is that your body wakes you up to breathe. And a lot of times people don't even know that they're being woken up at night, but they'll be woken up maybe multiple times in the middle of the night, and they don't get good sleep, so then they're tired the next day. And the other thing that I can do is it can make your blood pressure go up. Now, you probably know from your brother that there's a treatment for that, which is to wear a special mask that puts some pressure into your mouth.
I don't want to be on that machine. I don't want to be wearing no machine.
Okay. I'm with you. I don't want you to have to wear a machine, okay? However, I think it would be a good idea for us to check and see if you actually have sleep apnea or not, because if you do, we might have to consider something like that. And I guarantee you we would work very hard with you to try and help you tolerate it. And the reason it's important is because I also noticed that your blood pressure is a little bit up now. Maybe that's because you were waiting a long time, but when you have high blood pressure, that can give you complications. And also, if you have sleep apnea and your brain's not getting enough blood and your heart's not getting enough blood, you could potentially have some heart rhythm problems too. So it's kind of important to check on that. So I was hoping you'd be willing to, between now and the next time I see you, see if I can get you in with a sleep center which is a place where they study how people are sleeping and see if you could spend a night with them while they monitor you and see if you might have sleep apnea. Is that something you'd be willing to consider?
I don't know. I have to think about that.
Okay, well,
I don't want that machine.
no, I hear you. I hear you. It is a difficult thing to think about, but think about it a little bit, and think about questions you might have for me about it. And I'm not saying you have sleep apnea. A lot of times I'll send somebody for a sleep study and they don't have it. But back to what may have caused you to have sleep apnea, if in fact you do, okay, is your weight gain, which you came in here telling me about. And I know I have to kind of watch my time here because I'm behind already, but I want you to work real hard with that dietitian and work on weight loss, because if you're successful in losing weight, and I do believe in you, you're going to lose some of the extra weight that might cause your tongue to block your throat there, okay? And that would be the best way to do it, so you wouldn't necessarily need to do anything else for it. And when you work with a dietitian, I want you to understand that I'm not asking you to be skinny, and neither is the dietitian. We want you just to lose a little bit of that weight that you gained in the last few months, so you're back to where you were. And set a goal that's reasonable, that's not too much, maybe even just 10 pounds between visits with the dietitian, so that you gain your confidence back. I think sometimes people lose their confidence when they see themselves gaining weight, and she can work with you on that, and I'm confident that you can do this. And I want to see you again. Ideally, I think maybe, let's say in 2-3 weeks, because I want to check your blood pressure again. And if you're able to, I'd love for you to maybe when you stop in at like a Walgreens or a Walmart or something like that, if you could, sometimes they have those blood pressure machines. If you could get your blood pressure taken there at those machines and write it down for me on a piece of paper, it'd be cool if I could see if your blood pressure, is also high when you're not, a little stressed out like you are when I'm an hour late to see you. So. Does that sound okay?
Yeah.
I'm sensing that you're not real happy today, and I know that it may be because I'm late. But is there something else you wanted to talk about?
No. Just kind of taking all this in.
Well, I'm going to go ahead and let my dietitian colleague know that you're ready for her. And again, I apologize for being so late. And it's good to see you, and I'll see you again in 2-3 weeks, okay?
All right.
You have a blessed day.
You too.